That's that. Now turn the page. The next page is all your select alls for all your precautions, right? So precautions are, where are we? Generating solutions. I just left prioritizing hypothesis. That's what this page was. Which shock is it? Prioritize the hypothesis. Was it cardiac, neuro, or respiratory? Which one was it? This page with all these damn precautions is now fixing. Start generating some solutions, preventing further damage. Y'all feeling me on this? All of this is here, number 8, part of the test plan, physiologic adaptation, and your precautions are under safety. Okay, so if you look, these are easy, you know them well, but I'm going to point out some things you may not know. Do you see how it says bleeding precautions? I put the word thrombocytopenia there. What does that mean? Low platelets. So everybody with thrombocytopenia, low platelets, alcoholics, everything else need to have these precautions. So if you look at these precautions, I put the no's together. Y'all see it? No razors, no flip-flops, no flossing, no contact sports, no enemas, suppositories, and sex, anally. No aspirin, no NSAIDs. Now, what I did differently on this page that qualifies as one of my updates I had to make, back in the day when Ashley was in class, the test still had a lot of brand names on them. We started getting some generics, but she got a lot of brands. So we have brand names here on your old, oh my God. These are all your generic names for all of your NSAIDs, the ones by prescription. For example, you had 2 nurses stood right here in this spot, told you how they passed their test, and they both had Celecoxib on their test. If I were you, I would highlight that. Celecoxib under NSAIDs, no NSAIDs. Do you see it? Okay. All right, so that's another one that used to be on the paper. If you look at an old, oh my God, it would have just said Celebrex, because that's what we called it, okay? Now your patient does not know how to say that. So once again, to tell yourself all I gotta do is learn all generics is fucking crazy, because you're gonna kill somebody out here. Your patient gonna come in and tell you they took Celebrex, and you sitting there not knowing that's an NSAID may not understand the relationship it plays in her bleeding out. Okay, you say, you know, you got all these meds, you're looking at the damn Epic, you see all these meds, what do they mean? And this one is not easy, so I put that in there for you, and you just gotta kind of remember. Now, what about that ketorolac? What's another name for that? Toradol. Yes, Toradol. Very nice. You care about that. You really care. Ketorolac is Toradol. Okay. All right. So there you go. Now, notice it says no alcohol, no vitamin E, and then it talks about no G herbs. Do you see the G herbs? Remember that you, my dear, you are an alcoholic, and therefore you need to remember all your G's. The way you alcoholics remember your G's. You like white liquor. You alcoholics still with me? Okay. Ginger, ginseng, ginkgo, biloba. That's 3 of the 5. Everything else you can figure out. Garlic and green tea. Do you see how we did that, alcoholics? Okay, mama. So you got it. Boom. Go back to your gin. You'll be fine. Okay? Now, so that's your 5 G's. The one you forget and are very naughty about on your test, like the shit in this little list, is that oozing at the IV site. They're gonna have that on there, I promise you. And just in case you think this is textbook bullshit, let me help you with this. My papa had mesothelioma, and it's a long time ago, he's gone to heaven, but let's look at that, mesothelioma. You guys may not know what this is, and it does show up on the test. Who knows? Oh, go ahead, honey. Yes, this is lung cancer, because it said OMA. from asbestos, meaning it's the type of lung cancer you get and you never smoked a cigarette, right? Okay, so he died from this. You know, they got the commercials on how they pay you and all this shit. So he got the mesothelioma. He's getting chemo. Before he even got the chemo, to show you informed consent was wonderful. I love UH. I love UH and the clinic. But at this point, my papa was at UH with the UH doctor, University Hospital doctor. So Dr. Halmos looked him in the eye. It was sitting right on his level. And he said, we're going to give you some options and we're going to do whatever you tell me to do. You have, with nothing, you do nothing at all, you have about 6 months to live. If you do the chemo and the radiation, we can probably pull that out to 18 months to 2 years. My papa, my youngest daughter, is his only grandchild. She was graduating from high school. He wanted to see that. So he looked Dr. Halmos in the eyes and he said, I want to live. Let's go. What do I need to do? He said, okay, let's do it. He did the chemo, he did the radiation, and he lived 5 more years and moved her into Ohio State. So you can be God. I love it. He just knocked that shit out the box and lived 5 more years, okay? Now, so during that time, I'm like old school. I don't believe in leaving old people to do their own thing. Whether it's my dad or my papa or my mama, I'm gonna be with you the whole time. So I'm with him at his chemo. I don't tell people I'm a nurse, neither should you. You go to these different appointments, shut your mouth. Never ever tell. Because number one, they're gonna treat you all funky-fied, and number two, you're gonna intimidate people. That's never good. So let's just sit here and be cool, and I'll just study, because I think I was getting my PhD or something crazy. So I'm gonna study. I have a bag. I'm called the bag lady because I always have a bag of books. So I got my bag of books. I'm gonna study, but I'm watching every fucking thing. This nurse is the same nurse that always has my papa, because he gets this shit every 3rd Thursday. So cool. She's putting the IV in his arm the way she should, but I noticed when she did it, there was what? Oozing at the IV site. So much so, she had to put additional pressure and what we call reinforce it with a bunch of damn dressing, hold it, okay? So I'm watching that shit, right? I said, oh my goodness, it's like kind of coming through a little bit. So she put another, okay, cool, I'm not saying nothing, I'm just watching this shit. So now, what do you think about what we wrote earlier? Chemo, radiation, cancer. What was the 3 letters? And. What did it mean? Before you can hang chemo, number 1, you know you have to be certified. Number 2, you have to put the PPE on. Number 3, you have to get another nurse to check it. But before you actually hang the chemo, you must check your patient for how severe is their aunt. Because depending on how severe it is, they may or may not get chemo that day. I think she forgot why she was doing the things we do. At least she forgot why we were doing the things we as providers order. She was going through the motions. She had drawn the blood at the time of the IV, which is exactly what we do. You send that off to the lab. You send the order down to pharmacy. They make up the chemo. Before you hang the chemo, you check that result you sent. No, she brought the nurse in. So I know when there's 2 nurses showing up, we're getting close to hanging the chemo. They're in full PPE, so we're really gonna be hanging the chemo. They're doing their ID check, so we're super close to hanging the chemo, and I don't fucking know what his labs are yet. So I decided to just pipe up and say something. How was Papa's labs today? Oh, I'm glad you said that. Hold on, I'll go get them. What did that tell me? No. So that is a nurse that's just going through motions. What does that mean? That means that you don't understand the rationale for the orders that you've received. You did do the CBC. You did. You did do it before the chemo, but you never checked the result before you hung the chemo. So when she walked in, she was horrified. She had this look, and she looked at my dad, my papa, because this is my father-in-law. She looked at my papa and she said, oh, no, you probably don't need to get chemo today. I said, what? Let me guess. Is it the platelet? She goes, yeah. I said, what, about 40, 45,000? She said, 44,000. How did you know that? I said, the oozing of the IV. It went on for a while. What did I teach you? Below 100, it's going to take you a minute to clot, right? Back to that again. And it took so long, and she had to come back and reinforce it. I'm like, shit, fuck, we less than 50. Now, what would have happened had she hung the very medicine to make this worse? He would be dead that day. No other day, that day. You feeling me yet? Because he already got a hole in his arm, so he's going to start bleeding out. You see? Again, you are going to kill someone if you don't understand what you are doing with these very seriously ill patients. Okay? So he's fine. We gave him steroids. It brought up his platelets with no problem, but he definitely did not get chemo for a good 3 weeks. He skipped that whole 3-week period. Then he's mad at me. You know I need my chemo. What you tell that lady? Listen here, Dad. Okay, so you just know you got to do what you got to do. Now, so in this bleeding precautions, I highlighted it because I need you sharp. When you start IVs, let that motherfucker clot off quickly or be alarmed. Okay? That's what I'm telling you right there. Okay? Now, you're going to teach, right? So we say teach call lifts. Call lifts is what you teach. And it means call lift this, call lift that, call lift this. You teach the call lifts. What are you telling this patient? Tarry stools, bleeding gums, bruising. What is the pinpoint red rash? Where will it be? Arms. Arms, they may not notice it on their chest, but it can be on the chest. But the arms for sure. Show you a bunch of petechiae. I have to show you an actual patient. I want to show you. Okay, so your petechiae looks like little red pinpoint dots. On brown skin is kind of like dark red, really dark red. Tea-colored urine, coffee ground emesis, nosebleeds. What is the nosebleeds fancy word on your test? Epitaxis, right? Epitaxis. Is nosebleed on your test? Epitaxis. Let's just put that word there. Some of y'all was a little confused. Okay? Since you looked all crazy and retarded, put that down. Then I added rigid abdomen. What's another way to say that? Rock hard, rigid, board-like. Now, what does it mean, all three? You are hemorrhaging inside. That's why on page 7 that says board-like abdomen, right? So you know all of these are going to be, page 7 taken over. So that's your problem. If your patient has that, that's 911. Now, seizure precautions, you pretty much know this one, but let me holler back at the girls and the boys. Look at what else it says for the seizure precautions. You're going to see something that says BEM. BEM is in the title of the seizure precautions. It says bedside EEG monitor, BEM. You see? That is what we do with these patients who come in and we don't know why they're seizing, just that they are. What did you have to remember? They got to wash their hair. We have to be able to stick the little probes on their hair and their scalp. It's a television that you have in the room with the patient, and we're watching that television, not you and I, but someone is watching that television 24/7, and you'll see the patient in the bed right here, and then you'll see all their brain waves going across here, and that's called BEM, okay? All right, so you gotta know that, all right? Bedside EEG monitoring. And then you see all the other rest of the stuff that goes with it, but even the thing of neon colors is on there. Do you see? Neon colors can give somebody a seizure. Blinking lights can give people seizures. Fluorescent lights can give people seizures, which is why you see a lot about the dimming the lights. And then the one you probably missed the most on the test is no TV. Yeah. ICP pressure precautions. Remember, anyone with a Glasgow less than 8 needs these. That was on the test. Glasgow less than 8 needs ICP precautions. And remember the rule and the rhyme. Glasgow less than 8 intubates. Glasgow less than 7 go to heaven. But call so we can keep your organs. Sorry. All right. So, all right. So now you see it says no, 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 no. All the no's are there together, right? Let's think about what we're doing with those no's, shall we? If we increase pressure in any part of my body, it's going to increase pressure in every part of my body. This brain of yours, when we talk ICP, has 3 components. The 3 components include cerebrospinal fluid, blood, and of course brain. Hello. These are the 3 components. And with these 3 components, an increase in any one of them will mean something has to decrease. That's bad. Because, for example, let's take your brain is swelling, which means that compartment increased. Y'all with me? Will this or this go down? Blood. So blood equates to what? Oxygen. If this goes down, it's going to do it by way of vasoconstriction. You're going to lose blood flow to the brain. You're going to have a behavioral change. Makes sense. Irritability, anxiety, confusion, LOC changes. It makes sense. Decrease oxygen to brain. We said that earlier. It's the first thing I said when you walked in. It's those behavior words on your pages at the top, right? It builds. That's why the Oh My God packet is totally your fucking test. Like if you really knew it, it's your test. But you guys look at page 3 and go, Okay, so again, if this goes up, this comes down. Let's do another one. My student was sitting way in the back of the class with her head down. She's a lot like me, kind of like hyper, bubbly, crazy. She usually comes in dressed to the nine, not me, not in the winter, never. But she comes in dressed to the nine, makeup done and all the rest of the bullshit. Now, she come in looking like a little bum with the house shoes and everything. Okay. All right, whatever. She goes to the back seat. During my lecture, because I notice everything, she got her little head on the table, looking down and shit. What the fuck? So I decided to play a little trick. I said, okay, I know what. I'll say some shit she gotta look up for. I said, y'all see this right here? And I wrote some dumb shit. Y'all see that? That right there. I'm talking about that right there. She ain't even move. I'm like, fuck. Put that shit down, walk to the back of the room. Baby, you okay? I'm all right. I just got a really bad headache and the lights hurt really bad. And I don't know, I probably shouldn't have came. It's like so loud. And I was like, oh, hell no. I said, so what's going on? Well, I've been having these really bad headaches. And first they thought it was my eyes. And then the other day, 2 days ago, which I know about that time frame. That motherfucking time frame, yeah. 2 days ago, I had a lumbar puncture. What? Should never said that shit in my class. Let's examine what I wrote. She had a lumbar puncture, a hole put in her back to get some cerebrospinal fluid. Okay. If this goes down, something got to go up. Blood. I said, oh my God, you had a lumbar puncture? Okay, you need to get out of here. And her friend, best friend, sitting next to her, needed to drive her to Hillcrest because either you're still leaking fluid, right? Because that could be a possibility, or the fluid is accumulating all over the place. Hi, Biscuit. He's so silly. Let the baby go. Hi, baby. You're so pretty. Yeah, you got your haircut. You went to the booty shop. Oh my God. Okay, so in this case, this patient is getting very, very sick. Guess what the ER told her? They told her that her ICP was near 200 and that she was about to have a seizure any second. She had surgery within a half an hour. Again, if one goes down, something else is going to go up. She was diagnosed with hydrocephaly. She still has it. She still has it. The clinical instructor a semester earlier told her to get her eyes checked. She did. These son of a bitches told her because she was so young, there's really no need to do the glaucoma check. If they had done the glaucoma check, they could have picked up on her hydrocephaly way before we did. You're never too young to get a glaucoma check because we're checking the pressure of your eyes, for crying out loud. Could have picked it up, could have, but they did not. Okay? So she is very, very much thankful that we didn't just let her put her damn head down in class. Okay? Now, you got it. ICP precautions. That young lady had all of these to worry about because if you hold your breath, you're increasing pressure. You blow your nose, that's increasing pressure. Vomiting, where is that increasing the pressure? Let's really do this, okay? Intra-abdominal. Coughing, interthoracic. Blowing, intercranial. Pressure up anywhere is going to increase pressure everywhere. What other pressure are we talking? Blood pressure. Know it. Understand it. Okay? So, you minimize suctioning. You minimize crying. Where it says minimize crying, do you see where I wrote sedate babies? You're not going to know that if you don't write sedate babies. Here's what I mean by that. You got to put them out. You just got to put them out. It sounds crazy as hell, but you got to drug the babies up because crying increases their pressure. Okay? Now, what kind of medications can we expect to use with this patient? I want you to add a category because you're trying to learn these damn meds. Benzodiazepines, huh? Benzodiazepines at the bottom. Add that. Let me put it up here because I'll be acting like y'all can't spell with the shit. Benzodiazepines. There you go, babies. You got it? Okay, now, so if you remember your group, benzodiazepines, these are anticonvulsants. Remember that? That's what they are, anticonvulsants. Okay, and then you have your antiemetics. And then you have your mannitol. You knew that. That's nothing new. Do you remember on the page when we did the NCLEX quickie, we talked about immunosuppressed patients? Okay, well, the next one are the precautions for them. This is your neutropenic precautions. And so if you recall, I told you I keep the avoids together, the no's together, and then a bunch of other crazy. But let me just point a couple things out, huh? Do you see where it says no attenuated vaccines? You gotta know your song. What's the song? Measles, mumps, rubella, varicella. Woo! If you don't do the woo, you're fucking up. Let's do it once more, okay? All right, so you ready? Measles, mumps, rubella, varicella. Woo! Oh, yes, yes, you're gonna pass. Yes, you are. Okay. Woo, no. Okay, so now listen, Truman, listen. These are called attenuated vaccines. What does attenuated mean? Live. What does live mean to immunosuppressed? You're gonna get that disease. You see? So no. You can't let these patients have none of this crap. Okay? Now watch this. There's more. Do you see where it says avoid children? You had to know cytomegalovirus was what CMV stands for. So I'm going to write that on the board too. These children carry cytomegalovirus, and it doesn't hurt children, but it hurts immunosuppressed patients. Cytomegalovirus, CMV. It's just a virus. Just kids have it all the time, but adults that are immunosuppressed will die. Okay? Go down to where it says condoms and highlight it, because that's the one y'all forget to tell your patient. Now I get fucking the world. Now, if you know anything about today's world, you know there's something called dating sites, right? Y'all on some trash lately. Y'all ain't even going for the nice sites. Y'all just going for just trash sites, okay? So everybody fucking everybody catching crotch rot, everybody spreading. Now we got 92-year-olds with crotch rot. I don't know what to say about y'all. So this is why I need everybody in the room to say and know and understand that you cannot be embarrassed as a nurse to tell this old ass woman or man that they need to use condoms. Now, I was very happy. Before Mama could get her chemo for her breast cancer after her mastectomy, the nurse had a pre-chemo visit. This was at university. They're very cold with their shit. They're the best. So the nurse had the pre-chemo visit, and I'll be damned, she literally said, no anal sex, and she threw them condoms in there. And then she threw that part in there about if you get, and that's not in the Neutropenic, but this is what she threw in there. I was cracking up. She threw that part in there about, well, if you start to get real sick and nothing works, like none of the medicines your doctor gives you work, you just call me because we'll have to get you some THC, which is another word for pot. Oh, Mom, you gonna be smoking pot. Okay. Oh, shit. Okay, now I don't even smoke. I was like, oh, this ought to be fun. So you have a down-to-earth nurse. She gonna make sure she cover all of this. Why do I care that you really know this one? Because, here we go. Years ago, I had a 27-year-old patient. She was a gravido 1, para 0. What does that mean? First pregnancy, no children. She came in, and the problem is when you have these patients and they're on their first baby, how long, watch the question, how long is the first stage of labor? Don't give me that bullshit. How long? 24. That's good, B. 24 hours on average. Do we all agree? Now remember, what is the first stage? Going from 0 to 10. You good? What is the second stage? Pushing or delivery. Yeah. How long does that last with the first baby? 2 hours. Or if you have an epidural, 3 hours is allowed. Are you still with me? What is the third stage of labor? Placenta. How long should that take? Less than 30 minutes. The fourth stage. Recovery. And what I teach you is fourth stage, 4 hours. That is your postpartum recovery. Y'all good? See how I snuck that maternity in because you hate it so much? This was my patient, so let's talk shop. The day that she went into labor, I had plans. No shit. The plans were not very elaborate. That's how boring my life is. They included me and my oldest daughter and my youngest daughter, who are 11 years apart. And the little baby was really little. The older baby was at Spelman, but she was going to call me on the phone and we were going to make this work. So the older baby's in college, the little baby's at home. Me and the babies are going to watch Top Model together. It's the grand finale. Is anybody there with me yet? Okay. If you remember the grand finale, Eve won. Are you still with me? Remember that spot on her face? Remember that? Okay, so now we don't know that Eve won yet. This woman calls in the middle of my plans to watch Top Model. And she says, oh, Shelly, my water broke. Now get this. Remember, this is the best day of her life outside of her wedding, right? If she had a wedding, that should be number one, my God. But she didn't, so this is it. This is her birthday party. I'm not gonna spoil her birthday party. I have to be excited. Even if I'm faking the funk, I gotta be excited. So I'm on the phone with the baby. I'm like, oh my goodness, you're gonna be a mommy. I'll be there before you will. See you when you get there. I always pledge that I will be there before you will. So you don't have to have strangers touch you. So I get there, I'm there by the time she comes. I tell the daughters, y'all better figure it out. I can't do it today. When she comes in, she's kind of lightweight salty. She's salty because she says, and I quote, I wanted to watch Top Model. Good, that's the right answer. Well, we do have epidurals if that's what you wanted. Yeah, that's what I wanted. I said that in my birth plan. Well, good, we'll give you an epidural and we can all watch Top Model. So there she was doing her labor thing. We're all watching Top Model. The daughters, I could talk to them. I was talking to her. I'm in the room. We're having fun. Baby is, Eve won, and then when Top Model was over, of course, being ghetto fabulous, I looked at her and said, ain't you got to push or some shit? I mean, come on, now you don't watch the show. She's like, I do, I feel something. I don't know what it is, because her first baby, she don't know what the fuck she feeling. So I'm like, okay, well, let me check it. She was 10. We had a baby so fast, it was great. Now, here's the deal. She came back for her 6 weeks checkup. Let me help you with this. If I ever remember a postpartum checkup, I got a problem, because those are so uneventful. They're kind of boring. I do your PAP, see you next year, right? That's pretty much how it went. She reminded me that something else happened at the 6 week checkup. She reminded me of that when she called me about a year and a half, maybe 2 years later. And when she called me, she said, hey, Shelly, do you remember when you did my 6 weeks checkup, you told me there was this ugly mole on my leg and I needed to get that shit checked out? I said, yeah, it sounds like some shit I would say, but I don't know that I remember. So she said, yeah, it was like not that big, it was little, but yeah, you told me to get that shit checked out. I said, well, yeah, did you get it? She said, well, I went to this one dermatologist, and we are not going to say his name in this room, but a lot of you know who it is, because it's the #1 black dermatologist, gives the same damn ointment to the same people all the time. See everybody Saturday morning at 8. Don't say his name. Now, she went to that dermatologist, and he told her, wrongfully so, that, oh, I wouldn't worry too much because, and at the time this was the big belief, Black people are not prone to skin cancer. We now know that is so wrong. Back then, that's what he thought. So she left it alone. He didn't need biopsy. He didn't take it off. He broke the golden rule. You got to know the golden rule. The golden rule says, if that mole is bigger than this eraser tip, it's got to be biopsied. And this eraser tip is 5 millimeters. So I bet you better know that. So what I do with my patients is I go like this. Big biopsy. Too big biopsy. Cool. Right. Again, this eraser tip is your guide. If it's bigger than the eraser tip, it's gotta be biopsied. He did not biopsy it. What she said, and I sort of remember, is this was the size of it. Biopsy. Are you with me? So she went on about her way, because that's what the doctor said. You ain't have to worry about no skin cancer as a black person. And then the stupid thing began to bleed, which is a sign of cancer. Something bleeding and it won't stop. It keeps going back and forth. You know, it stopped, then it started, then it stopped, then it started, then it stopped, then it started. Kept messing up her pants. She's like, fuck this, I'm going to get this off. I cannot deal. She goes to another dermatologist, completely, totally different dermatologist. He takes that bad boy off and she has the worst skin cancer on earth. Malignant melanoma. Her malignant melanoma took half her leg off. So they carved half of her leg right off of her calf area, just carved it off. When they carved that leg, they gave her chemo, they gave her radiation, and the problem, she calls me, let's see. When she called me to tell me she had malignant melanoma, that was like a year or so, 2 maybe after I saw her. A year after that, she called me to say, they said there's nothing else they can do. I didn't clue in because I'm kind of slow in the uptake. And this is my baby, so I just did not clue in to what the fuck that meant. But when people say, they say it's nothing more than they can do, that means I'm gonna die. And I did not clue in. And so I'm like, what the fuck is you talking about? There's nothing more than they can do. What is you talking about? She's like, don't worry. It's not that bad. She said, I'm gonna go to Australia. They have this real like experimental thing that has great outcomes, but I was just calling you because I'm trying to fundraise for the trip. I said, come over and get a ton of money. So gave her a ton of money. She collected whatever she needed to collect. And then she called me back in April, crying, just a few months later, crying. I'm gonna quote her because I want you to never forget it. Shelly, are you open? No, baby. I was teaching school today. I'm not open. You know, I'm very part-time. I know you're trying to retire, but please, you sure you can't see me? I said, okay, well, what's wrong, baby? Let me quote her. This motherfucker done gave me some shit. I said, oh God. What did I tell you? Chemo, radiation. She had her, you know, surgery. In my mind, this motherfucker done gave me some shit means immunosuppressed with an infection. I will open up this office. My office was right down the street there on Wilson Mills and Brainerd. I opened up the office and she wasn't lying. This is what that motherfucker gave her. Gonorrhea, chlamydia, and trick. All 3. This one I could see that day. These I sent cultures out, but I knew what it was because when I went inside, she'd jump up on the ceiling like from pain. That's what these 2 do. Because these 2, you better know what I'm talking about here, give you PID. What does that mean? Pelvic inflammatory disease. Why did this give her that so fast? Immunosuppressed. What would have helped her? Condoms. Every single one of these are prevented with condoms. This is her baby daddy with this bullshit. That motherfucker there. Yeah, she called me the right word. Biscuit, the biscuit leave, sure, you be walking on the hole like you. Okay. All right, so then what I did was I admitted her down to University Hospitals. I got an onco consult. I got the fucking pain management. I had to get infectious disease involved. I stayed there with her that day just to see her get settled. And then I was able, with the pain management, she gave her PCA pump, because she had a lot of pain. I was able to do my bimanual exam. She got a fucking big ass mass. This cancer has gotten crazy. It spread to her pancreas. This was in April. I sat at her bedside and she said, and I quote, I asked God, remember bargaining in the grief process? I asked God to please just give me a little bit of time to see my baby's first day of kindergarten. She was dead 30 days later. Dead. Gone from here forever. And she was beautiful. Her baby, now babies are ugly when they're born. This baby was one of the prettiest babies I've ever seen in my life. Just beautiful baby. Okay, she's gone. That's my baby. This was my baby. She's gone. Okay, so I want you to never take what you teach lightly. Someone had just told her that, and she knew that every now and then, what the fuck is that? He'd cheat, right? She know that. So maybe she would have been encouraged to use a condom. She might be here still. I don't know. Okay, she might die anyway, but maybe slower, not so bad. Maybe see kindergarten, whatever. But she died rapidly from this because any infection, I told you, will kill them. Okay, all right. Now, so you got it. You got everything on here. Dysphagia precautions. You know what that's for. That's for your stroke and your Parkinson's patient. And then you need to know something else. I don't know if you understand. Did you know that Alzheimer's moderate stage needs dysphagia precautions? That was on your test. In other words, Alzheimer's has a bunch of stages: early, moderate, late, whatever. In that moderate and up, they need dysphagia precautions because they're losing some of the ability to do their motor skills. I put the CVA for stroke, Parkinson's, ALS, myasthenia gravis. You can put that Alzheimer's in there for you. And then one of the things that you might not know, a lot of people I see at work don't know this, your patient needs to stay 30 minutes up for the whole meal and 30 minutes after the meal is over. Highlight it. The one you get wrong the most is the chin tuck and the flex. Do you see it? Chin tuck, flex head. Do me a favor, everybody in the class right now, go like this. Try to swallow. You can. Go like this. Swallow. You can. Flex, flex, flex. This is hyperextend. This is flex. Flex. Chin tuck, flex. You're going to be in that test. Okay, suicidal precautions. Now, you see what I highlighted, don't you? I know it sounds like common sense, but your little ass better look what I highlighted. I said keep all them damn doors open. Oh, you think you're just going to let this 16-year-old boy piss and you're going to close the door because you're feeling some kind of way about watching a 16-year-old piss? No, you're going to leave that door open. Because that 16-year-old who said, what in the fuck, can I just close the door? And that nurse who felt some kind of way about watching a 16-year-old piss said, okay, I'm going to close the door a little bit. And that's when he blew his fucking brains to the other side of the wall of the bathroom. He is now dead. And she is liable, and she'll never practice again as an LPN. So I'm gonna say this again. You keep all doors open. Ain't no pissing in privacy up in this bitch. You lost that opportunity. Okay? Keep all doors open. Then let me tell you something else. These are all three things that happen. So you gotta know what not to do. You know how you give the patient the medication and you gotta peel the foil pack bag and it's in a little square? Remember them? She threw that motherfucker in the trash. Wasn't nothing wrong with it any other day. But when she threw that little paper from the foil pack that she peeled in the trash, it's very sharp edges. He got that out the trash and slit his wrist very easily. If they want to kill themselves, they're going to find anything. Okay, in case you didn't get a hold of that one, maybe you sleep on the uptake or whatever. Here's a third one. Patient goes in the shower. The door is open. She not doing anything crazy. Different nurse. The door is open. She's knowing that he's bending down. She's not really paying attention necessarily to the fact that he's bending down a little bit. Frequently in the shower, he was whittling the little screw in the shower drain. He was whittling that loose every time. This day he gets in the shower, he pulls that nail out because he's whittled it away pretty good, and he sticks himself right in the neck. Anything can happen, beloved. Take suicide precautions very seriously. These patients do not get a PCA. What is a PCA? Patient-controlled analgesia. What is that? A button with a string attached? They don't get that. They don't get nothing like that. Call bell, nothing, right? Because what do they have with them? A sitter. but take the sitting serious, okay? All right, so that's the stuff I got down.